Thanks very much. So I make it in English. My French is not as good, so I can understand, but I don't speak so well. So it's about modern analysis of patellofemoral pain, and moving forward is here. So SPECT-CT is a modality of hybrid imaging. You combine the 3D scintigraphy information with the CT, and then you get these combined colorful images. And this is useful for native, but also for arthroplasty patients. So this is our protocol. So you need to use a specific protocol to get an understanding of the biomechanics. Only then you can use all the information which is in this imaging modality. So the idea about this SPECT-CT is a pain pattern or pattern analysis. So you analyze the pain pattern and you analyze the SPECT BTU uptake pattern, and then you get the information. Normally a standard bone tracer is used, which is a diphosphonate, and this diphosphonate is targeted towards active osteoblasts. We have established a specific localization scheme, and so this helps us to identify these pain patterns. Together with AI, in future we are probably getting much better in identifying these patterns. So for all of you, BTU, bone tracer uptake, is not the same as bone marrow edema, and this is important to know because a lot of people say, okay, you can also do it with the MRI because you see the BME. No, BME is an ill-defined hyperintense signal alteration in STIR and T2 or proton density fat saturated sequences of the subchondral bone plate. And BTU is the active information, the metabolic information you get from active osteoblasts. So histology of BMI is very unspecific, so that's why the BME is not really relevant here. So BTU is a better predictor of chronic medial knee pain, which was established in a paper by my wife and myself, and also by the Florian book from Balgrist. So there's also a good correlation of the BTU patterns with chondral lesions. So we could establish that actually the BTU pattern is increased with a more severe chondral lesion. And this was also done with imaging, and also was done with macroscopic information. And we compared the MRI with the BTU patterns in the SPECT-CT here. And you see there are different informations you get. Sometimes you have bone marrow edema, sometimes you have uptake, and it's not that in all cases this matches perfectly. And I think this is an important knowledge to gain, because you have to understand that in cartilage lesions grade 1, you don't have any BTU. Grade 1 and 2, you have more increased BTU, and 3 and 4, you have increased BTU. This is also dependent on the size of the cartilage lesion, as you can see here. So the important information you can gain there is this a chondral lesion or is it an osteochondral lesion? And this is very often very difficult with the MRI, and so it adds to this information here. So you can also gain information on native knees, as you see here. So if you have, like, for example, this patella bipartite, and this was formerly operated. This patient also got microfracturing of the patellar surface, and you see you get this information, and then you can understand better the biomechanics ongoing. If you go to the arthroplasty world, the information is even much bigger. What you get, because you can combine the biomechanical information from the position of the prosthesis together with the BTU uptake. So you can identify different patterns which are typical for remodeling or typical for pathology, and this is an important information to understand, and only then you understand better in which direction this SPECT-CT guides you. This is an example. You see this patient here. The patient has some overloading of the patella, but why is that overloading? It has a 14 degrees flexion of the femoral component, also 4 degrees internal rotation, and the consequence is the overloading of the patellofemoral surface. So the reason of this is not the patella, it's just the symptom. We analyzed a lot of SPECT-CTs, 240 knees. We looked at sensitivity for patellofemoral OA and could see that there is a high sensitivity and also specificity for these patients with a already in place total knee arthroplasty. And it's also good for loosening detection of the prosthesis. So coming to the end, I have 10 seconds left. SPECT-CT is beneficial for patients with patellofemoral pain. It doesn't show you that there is pain. It shows you the bone tracer uptake. It's an adjunct imaging to X-ray and MRI, and the analysis should be done together with an MSK radiologist and nuclear medicine specialist. Thank you very much.